My name is Dr. Alphonse Ofomata, the Medical Director of Marcel Ofomata Foundation.
Welcome to a special segment on the Marcel Ofomata Foundation's remarkable journey in delivering quality health care to rural communities. Today we take a closer look at the 16th edition of their free biannual medical mission, which took place on the August 23rd, 2024 across three significant locations: the Ozalla Isuofia Primary Health Care Center, the Palace of His Royal Highness Igwe Godwin Ezeadusionu in Nanka, Urumba North Local Government Area, and Landmark Hotel in Igboukwu, Aguata Local Government Area. This event marks the culmination of the Foundation's 2024 outreach efforts, building upon the success of the 15th edition held earlier this year.
This is our 16th edition of the Marcel Ofomata Free Medical Mission in Anambra State. So this is Igboukwu. Like today, we have had 3 sites for this free medical mission: the Igboukwu site, the Isuofia site at Ozalla Primary Health Center, and the one that in Igwe Nanka's Palace. So today, many persons have come and have enjoyed, have benefited from our gesture. So the charity of the Marcel Ofomata Foundation cannot be overemphasized, as many have expressed, given testimonies and expressed their joy and satisfaction for the services they have obtained today free of charge, ranging from provision of free eyeglasses, examination of eyes, like you see the eye doctors were here. You can also see some professional medical doctors here consulting, also providing health talks and public health enlightenment campaigns. And then the pharmacists are also there to dispense the medications prescribed by the doctors. Come here with a wide range of medicines that could treat a variety of ailments, ranging from diabetes, hypertension, peptic ulcer disease, and a lot more. We also deworm all the children and we deworm adults as well. Adults suspected to have health impairments. And we have also come to also treat a lot of other conditions, especially those that have been having acute conditions like malaria. We have treated malaria, upper respiratory tract infection, urinary tract infection, chronic diseases like diabetes and diabetes mellitus, and hypertension. Not just that, we have also carried out so many investigations in order to arrive at our diagnosis. We have carried out urinalysis, urine tests. We have carried out urinalysis, urine tests, malaria tests, Widal tests, pregnancy tests for women of reproductive ages that are suspected to be pregnant, in order to administer medications that will not interfere with the babies in their womb. We also carrying out free investigations for random blood sugar. Those who came earlier without food, we did fasting blood sugar for them. We also carry out hepatitis B and hepatitis C tests for them. We are conducting a wide range of investigations that will help us diagnose our clients and beneficiaries perfectly in order to ensure accurate prescription for them.
As the medical director of the Marcel Ofomata Foundation, Dr. Alphonse Ekanem sheds light on the driving force behind this humanitarian initiative, emphasizes the foundation's unwavering commitment to charity, and highlights the extensive range of medical services provided during these missions, from terminal disease management to various diagnostic tests like blood sugar levels and hepatitis B and C screenings. The foundation ensures that no stone is left unturned.
Can you give us empirical reason why your foundation embarks on this? What do you really want to achieve as in the overall goal, doing this free of charge, knowing the economic demand, vis-a-vis the manpower, the facility, putting this together is cost implication. What do you intend to achieve in your overall goal of the foundation?
Well, our primary goal, the primary goal of the foundation is to ensure that the poor, the difficult to reach, the less privileged have equal rights to access healthcare services. And for those who know the health-seeking behavior of our people, especially the uneducated or less privileged, the health-seeking behavior, is so poor, is bad, especially in this part of the world. So in order to give them the same chance of living like others, in order to help them, because they say health is wealth, it's true. It is quite true. So our goal is to ensure that our beneficiaries also have the chance of survival. Our beneficiaries also have to survive for conditions that are preventable, conditions that are curable, and conditions that are treatable. We are selfless in the service rather than aiming at achieving anything materialistic. Our goal and aim is to ensure that the community is safe for everyone to live. Our neighbors, our people live fine, happily, and healthy, because when there is health, there is wealth. So that is our utmost goal.
In his own words, Dr. Kanem explains why the foundation conducts these missions biannually, specifically in January and August. The overall goal is clear: to provide rural dwellers with access to quality health care, maintain regular medical checkups, ensure proper follow-up care.
And we decide to do this twice yearly, because when we come in the January edition, most of the time we make new diagnoses, especially on those who are developing chronic conditions or are discovered for the first time. And if we dispense medications over time and counsel them, advise them to go back to the hospital for follow-up, in order to ensure that they have gone for the follow-up or they are taking their prescriptions, their medicine as prescribed. So we make haste to come back in another 6 months or 8 months or 6 months, as the case may be, usually 6 more months. To that way we'll be able to follow up our clients. We have been here for the past 8 years, and because of that we have been quite acquainted. We are quite aware and familiar with most of our beneficiaries. So when they come, we are able to ask them, have you been able to follow? Have you gone back to the hospital? Are your symptoms improving, having improved, or is it worsening? In this case, we will know whether what we are doing is fine or right. So, and of course, the testimonies obtained from most of our beneficiaries show that we have not been wasting our time. We have not been wasting our energies and resources.
Over the past 8 years, the impact has been profound, with countless testimonies of lives transformed by this initiative. The success of this mission is not just in the medical care provided, but also in the ongoing counseling that beneficiaries receive.
Are there people who have been faithfully coming? Do you have records of people who they are regular? So you now can attest to their health record. Do you have such records?
That is why, if you could listen to what I said that because of our consistency, because of our regularity, that we have become acquainted, we have become familiar with most of our beneficiaries, most of the clients. So whom we have now known. For instance, I've seen many of them today that have been diagnosed some years ago of diabetes or even hypertension. And today they have attested to the fact that our outings have been quite beneficial to them. And of course, the blood sugar levels, their blood pressure levels have been in good control, because apart from having the medication, they have had an opportunity to benefit from our regular counseling. Health talks that we have been giving to them, advice that we give to them on how to live well and how to adhere to medications and on how to, live well in society, hygiene and otherwise, that will make them sustain a healthy, good life. So it's been a consistent approach that we have taken, and we've been very regular, and almost, I can say, it's been a routine for us to undertake these services twice every year, and we have never missed in the past 8 years.
Dr. Kanem expresses his gratitude to Dr. Marcel Ofomata, the driving force behind this philanthropic endeavor. The consistency of this mission has enabled proper documentation of beneficiaries, which is crucial for tracking their health progress and outcomes.
Many thanks to the sponsor of the foundation, because we are not being sponsored by anyone, not being sponsored by government. The foundation is not political, is non-governmental, and is solely sponsored by an individual, a private individual. So I say, may the Lord Almighty bless him for all that he has provided, taking care, or even the personnel, providing the logistics, the medications, and all that are needed, the resource-wise, to ensuring that this is sustained by this foundation.
Reflecting on the healthcare challenges faced by Nigerians, Dr. Kanem shares valuable insights into the common health issues observed during these missions. Hypertension, a silent killer, emerges as a prevalent concern, particularly among men over the age of 30. He warns of the risks of untreated hypertension leading to organ damage, heart failure, and other serious conditions. His advice is simple yet profound. Regular blood pressure and blood sugar screenings are essential, especially for those in high-risk groups.
From your experience, what people can work on naturally and also how people should handle their health?
Okay, for Nigerians, I would like to be very specific about the people of Anambra State in particular. We have discovered that although this is quite common as well, being a black already, you are at risk. Mostly male genders are at risk of developing hypertension. Hypertension is what we have discovered to be most rampant amongst our clients and beneficiaries. And then the book has, in a way, describe it as a silent killer. This is a silent killer because you might not know that you have hypertension until when you must have developed some organ damages, multi-organ failures. Sometimes maybe heart failure, kidney failure, retinopathy, that is you cannot see again, your vision is lost. Or nephropathy, your kidney is damaged. And retinopathy, some even during stroke, when they have developed stroke, they could have just been diagnosed of being hypertensive for the first time. Diabetes as well. So, as a routine, I will advise every individual, especially men from the ages of 30, from 30 to regularly screen their blood pressure, also check their blood sugar levels. And for women, especially those who have struck menopause, because for the women, estrogen is a protective or is a cardioprotective, protects the heart. So most younger women might not have hypertension. It's not exclusively, they could still develop hypertension. But for those who have struck menopause, I would advise them to routinely check their blood pressure, check their blood sugar. Everyone is at risk, especially those with family history of diabetes and hypertension are at risk of developing these conditions.
Dr. Kanem also touches on the importance of hygiene, particularly in rural areas where clean water sources are scarce. Gastrointestinal problems are common, and improving water quality is a critical step towards better public health. He calls on the government to play a more active role in providing clean water to prevent these avoidable health issues.
And then hygiene is very important in this community. It has appeared that a lot of people come down with gastrointestinal problems resulting from, from our interaction, it appears to be that their source of water are not clean enough. So the government will have to play a role here, providing clean water for consumption for the people of Anambra State.
Thank you very much, Dr. Kanem, the medical director of the Marcel Ofomata Foundation, and we most sincerely appreciate your dedication to this service. At least for 8 years you've been here. By now you should be speaking Igbo very well, right?
I have been speaking. I'm not just a medical doctor, just speaking Igbo. I'm a grandson of Igbo land. My mother is from Imo State.
That's great.
And I'm also an in-law. My wife is from Anambra State. So, yes.
You are an Igbo man. Yeah?
You don't have the Igbo blood running with me.
Thank you very much. We do appreciate you. And we hope that your commitment, this foundation, and your team.
As we conclude this insightful conversation with Dr. Kanem, it's evident that the Marcel Ofomata Foundation is making a lasting impact on the lives of many. Their biannual medical missions not only provide essential healthcare services, but also offer hope and support to those who need it most. We thank Dr. Kanem and the entire team for their dedication to this noble cause.
I think most of us, except I don't know, but then God will lead, God leading, God enabling us as enabling us.